The benefits of the nerve conduction and EMG testing is it really gives us a good idea of the physiology of your nerves, how your nerves are working. And so what we do is there's two parts. The nerve conduction part of the test is we'll put some different stickers on your fingers, hands, down by your toes and legs if you're doing a study for your lower extremities. And then we'll stimulate the nerves. We're using tiny amounts of electricity, but that you'll feel, and what you're gonna feel is kind of like, almost like somebody kind of tapped your funny bone. You'll feel a little pulse that travels down into your hand. It'll be really fast, faster than you can snap your finger, blink your eye. And on some of these, your muscles will move. Your fingers will move. If we're looking at a study in the lower extremity, your toes will move. And we'll be able to tell how fast the nerve is moving, as well as how big the response is. And we know based on your height and your age what normal is. That's really good information for you and your physician to know if the nerve is working the way it should. The other thing that we can do is what's called EMG. EMG testing is where we take a little tiny pin electrode. That pin is like the diameter, a little bit bigger than the diameter of a human hair. So it's like an acupuncture pin. We'll put that in some different muscles in your arms, potentially down in your legs, base of your neck, and base of your back, depending on which study you're having done. But we'll look at some different muscles. And the way we'll do this is we'll put the pin in the muscle. We'll look for a couple seconds while you're completely relaxed, and then we'll have you gently tighten the muscle. We'll actually be able to coach you on each muscle before we ever put the pin in, so we can get in, take a good look, and get out. And then we'll move on to some different muscles. As we look at different muscles, we literally can track back where the damage is in the nerve, how big is the damage in the nerve, how old the damage is, and then we can quantify all those things and get those to your physician, and then they can compare that, the physiology, how the nerve is working, against the anatomy, which is your MRIs, x-rays, and all those things to give you the best care possible.